Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Here in Kasarani, and on today's show we will be having a discussion on cleft lip and palate deformities, and of course we do have a nutritionist here who has joined us, and he will be shedding more light in regards to that topic and helping us understand more what it is all about. And of course, our dear viewer, if you have any questions in terms of today's topic, you can always send us an SMS via our SMS number 21760, or also leave us a comment on all our social media handles and your message will be delivered. So without further ado, let me now give our guest the opportunity to introduce himself to you, our viewer. Karibu sana daktari.
Asante. So my name is Felix Mtongai. I'm a clinical nutritionist here in St. Francis Community Hospital. And as a clinical nutritionist, I get to be part of the medical team that is able to take care of the patients in our facility, both in the inpatient and outpatient. And in the matter today that we are going to discuss about cleft lip and palate, I also happen to be one of key people that are able to manage those patients from the time they come in and even as we discharge them home after the operation. And so basically we will be able to dissect every bit of this topic, from nutrition bit, from development side, and literally any other question that the viewers might be having on this matter. Yes.
Wow, thank you so much. And maybe we could just get straight into the conversation, and we're talking about cleft lip and palate. And maybe there's someone who is watching and they do not understand which condition this is. Maybe explain to us what it is.
Okay, so like the way the wordings that we are using, cleft, lip, and palate. So when we mean something there is a cleft, it means there is an opening, or there is a something that is not crossed, basically. And so when we use the word lip, we've said cleft and then we say lip, it simply means you find that the baby has been born when the lips, mostly you find that the upper lips is usually the one that has a breakage. So you find that the lip is not complete. Like kwa Kiswahili wanasema kuna mwanya, unapata there is a breakage of the lips. Sometimes it might even be two lips, and sometimes it might even be also affecting the nose. So if the viewers, you've seen any child or an image of a child that has such kind of breakage in the lips, that even they are up to the nose, then that is what we call cleft lip. Now palate is usually something that you can't see by looking at someone, because palate is inside our mouth. The upper part of the wall that is on top of the upper part of your mouth, that is actually what we refer to as palate. Now, when we say cleft palate, then we mean now that upper part of your mouth. Since ours is crossed, you find that these babies again are born when there is an opening in that particular part, upper part. And since it's a very important part, because it's the one that is sometimes helps in terms of food movement, you might find actually one of the things that you can see from the outward is that when you feed such a baby, you might find even the milk is coming out of the nose, or even the food. Because now that upper part of the mouth is very important in a person when you're swallowing something. It actually helps in that process of swallowing. So because there's an opening, it is very challenging for them to be able to dilect food. So that's actually one of the things you can observe after the baby has been born. You find that you feed them, the food is coming out of through the nostrils. Now, because for the lips, it's very actually visible. You can actually be able to tell there is a problem with my baby. But the palate, some people even discharge these babies before they can actually notice they have such a problem. And that's why we are really emphasizing that for every baby who is born, it is actually important for us to be able to look at their mouth, just to be able to, as we are looking for other deformities, to screen the baby once the baby is born. It's also good to open the mouth and just look at it, because we've seen people discharging these babies without noticing. But for the lip, at least those ones are captured as early. Even the mother will of course see that the baby has a problem. In fact, if a baby is born with other congenital problem is where you deliver a baby who has some development issues. Such actually they must be also examined for this, because you might find they might coexist. Yes.
And you've said that babies are born with this condition, and some of them are even discharged without realizing they do have this condition. So is it possible for one to, realize that this child has this condition during pregnancy, or it can only be noticed after the child is born?
Good question. And in fact, some of the initiatives that we want to be able to run, especially in our hospital in St. Francis, is we'll actually be discussing on how during pregnancy we can start detecting these issues, so that we can even be able to support these mothers psychosocially. Before even they deliver, they can be able to know. So what I'm trying to say actually is that this problem occurs during the 4th week to around 10th week during pregnancy. So which means after the 10th week, a baby who will have cleft lip or palate has actually already developed that problem. And so which means 10 weeks we mean it's happening in the first trimester of pregnancy, which means during the 2nd trimester, we can actually be able, through a scan, we can actually be able to detect this, especially for the lip, and then we can be able to do an intervention. So the intervention that you might do at that moment is the psychosocial support. At least sitting with this woman to know that the baby she is carrying will be delivered with maybe a cleft lip. That goes a long way once this baby comes, and you can even be able to prepare psychologically what are the actually steps of treating or taking care of this baby once the baby is born. Because one thing we've also realized, and this is outside there, that these babies are actually hidden. Once a mother delivers a baby who has such abnormalities, many people are not very comfortable when you find that these babies are actually kept hidden in their homes. So at least when we begin that journey and we pick it using an ultrasound scan, because by the time you deliver, we can actually be able to pick it using a scan, then at least we can start this conversation a bit early with these women before even they deliver, and even showing them what the plan looks like once the baby comes. Yes.
Oh, okay. And earlier, when you were talking about, the palate, and you said that it can affect the feeding of the baby. Sometimes the milk can, pass through the nose. Does it also affect maybe their speech?
No, that's also a very good question. So actually, when you develop the babies who are born with cleft lip and palate, you find they might also have other oral cavity, in their mouth they might have also other problems. The first one is dental. So you might find even their dental formula, when they start growing their teeth, some of them might have a pattern that is unusual from what we expect, and that's why it's always good we involve specialists, the dental specialists, for some of these particular children. Number 2, you notice your lips and that part of the mouth that I've talked about that is called palate is very important for you to speak or to communicate. That's why you see there are some vowels or some words you have to cross your lips. Some of them you have to shape them in certain manner, and it is even worse for those now who have cleft palate. Remember, it's not a must for a baby to have the two. You can actually find a baby who has cleft lip only, or you can find a baby who has a cleft palate only, or you can find a baby who has the two of this condition. So it's actually affect also speech. So dental, speech, and then swallowing issues. They get also challenges in terms of swallowing. Yes.
Okay, and maybe now talk to us about the treatment that is available for the babies that are born with this condition, especially here at St. Francis Community Hospital.
Okay, so at St. Francis Community Hospital, we are proud to communicate that at least as a facility here, the only way to be able actually to correct cleft palate or lip is actually through a surgical intervention, a surgery. And as in Francis Community Hospital, we offer those surgeries to those children. So all we do as in Francis is that we monitor these children all the way, at least for the lips. It is we correct at the age of 3 months. So once the baby is 3 months of age, as in Francis Community Hospital, we have the specialists that we can be able to operate that child, and they can go to looking normal and having a normal smile like any other person if it was a lip palate, cleft lip. For those who have cleft palate, the repair can happen. We do it here in St. Francis at 9 months. So from 9 months onwards, we're able actually to be able to operate these children. So as St. Francis Community Hospital, we offer those surgeries. And in fact, in the month of June this year, from 21st to 27th, we'll be doing a free surgical camp that is targeting only those children who have cleft lip and palate. They will come, we'll operate them free of charge, and then we'll be able to discharge them. Yes.
Wow, that's very wonderful. And also earlier you had mentioned that babies who are born with these conditions, you end up finding that some of them are hidden by their parents. So, okay, apart from that, what are some of the challenges that you think parents and also babies with these conditions face, and how can the community support them to avoid this stigma and discrimination?
Now, so like you find that if you look at the numbers, these children are quite many who have this condition. And so just like any other type of challenge, development challenge that you find people have, is just also another type of development challenge. And no one is immune to this. Of course, there is discussions that some nutrients deficiencies like folic acid, preconception or during the first few weeks could be probably linked to some of these problems, and so which means any woman can deliver such a child. And so the society and the community need to understand that is not the doing of that mother, it just happened. And apart from that, now that is for the community. For the mothers, they need also to understand this is a problem that can be rectified. Like I've said, once we do the surgery, this baby actually recover and they just look very normal. So what is important is also when you deliver such a baby, try to be able to locate a facility that offers such kind of interventions, like St. Francis, since we do that. Then once the baby gets to those ages that we are talking about, we can easily be able to correct. That's one of the things that I can be able to say. I've actually, for the surgeries that we've done close to over 46 surgeries for this problem. And imagine out of those, there were 3 adults. In that population. So adult, it means people above 18 years of age with cleft lip problem. And so which means that also people need to understand in the community that we manage this problem when they are very young. You've heard me talk of 3 months, you've heard me talk of 9 months, which means we do not need to wait until these people become adults. We can actually work on those problems and correct them within those 2 ages that I've been able to mention. Yes.
Okay, thank you so much for that. And also, speaking of nutrition, you being a nutritionist, for the babies that are born with this condition, is there maybe a specific, food or diet they're supposed to follow, or they can just eat the normal food like any other child?
No, that's a good question. And for the longest, even healthcare workers outside there, they have been treating this baby a bit special, unique, not handling them like any other child. So I want to be able to categorically say that in terms of babies who are below 6 months, we expect them to be breastfed exclusively, just like children who do not have this problem. And so if a mother, you are watching, or you have a baby who has cleft and lip palate, please remember they can be able to breastfeed and grow well. The only thing is that now for the challenges that I mentioned, sometimes that some who have broken lips, the cleft lip, sometimes they might have challenges in attaching to the breast well so that they can suck. And so as a nutritionist, there are 3 maneuvers that I train most of those mothers to be able to do. So how they position the baby. So if, for example, it is the left lip that is as an opening or a cut, then at least putting that baby on the other breast can actually be able to help. Breast is also a very soft tissue. It can be able to help to cross that part that is open, and then the baby can actually be able to suck appropriately. For the milk coming through the nose, coming out through the nose, there is how also you can position that baby using 3 position. We have what we refer to as modified cradle hold. Is a position that I train mothers here. There is also dancer hold. Is also a position you can position the baby so that at least, because milk, apart from the swallowing reflex, is also gravity helps it. So these positions also are meant follow the gravity to be able to support the baby to be able to swallow comfortably. And then apart from that, also there is something else we call rugby hold. So rugby hold is also another position that the mother can be able to hold the baby. So these positions are able now, combined now with that attachment that I've mentioned, able to ensure that 1, the baby sucks well, 2, we reduce the milk coming out from the nose. And for most of mothers, some of them are afraid to breastfeed because of something like that, the milk coming out of the nose. It is not harmful. It is good to know every human being, including myself, our noses are linked to our mouth behind. It doesn't go anywhere in any other way. And so which means it's just that they need just to wipe the baby and just relax and maybe improve on how they have held the baby. And everything will be quite okay. Yes.
And also, while you were talking about the treatment that you offer here at St. Francis, you said that you can start with babies from 3 months and others from 9 months. Mm-hmm. And you talked about surgery. So is it like one surgery, or do they have to come back again?
Now, that's a good question. But I've remembered we've not also adult babies who are above 6 months. So for the babies who are 6 months upwards, we recommend using developmental milestones to know what type of texture of food to be able to give them. I'll use 3 illustrations that can be very easy for our viewers. So for a baby who can be able to sit down, we recommend you give them pureed food, which means they can eat any type of food as long as it's in puree form, which means you can use a blender or you can use pestle and mortar and crush food using some soup so that it becomes a pureed. So when we talk about pureed, for our viewers' sake again, I mean something that looks like very thick porridge. That is the texture of the food, which means you can convert every other food to that texture and feed your baby comfortably. For the babies who are starting to crawl, the ones who are now crawling in our house, and they have this problem of cleft lip and palate, now you can be able to move them now to mashed foods. Now they move from pureed to mashed foods. Then for the babies who can be able to walk, they can actually be able to eat solid foods, just like we actually eat solid foods. So I think that becomes very easy for our viewers, that those are the 3 things that you need to know. The baby can sit down comfortably. At 6 months, that's when they start sitting. Then just know you can give pureed or very food as long as you convert any food to puree. They have started crawling in your house. It's time to move them from pureed to mashed foods. And then now they have started to walk around supporting themselves with a chair and tables in the house. Please now move this baby from mashed foods to semi-solid foods because they are actually ready for that. So that is the only difference compared to these other children, because the others sometimes we tend to be able to move a bit faster without using development milestones. We tend to move per every month in terms of changing the texture of foods basically. But these babies who are born with cleft lip and palate, we highly recommend someone to be able to use those development to be able to monitor them. Now, when it comes to the question of surgery, now, so remember, if you have a baby who has 2, the cleft lip and palate, and we are saying lip, we start repair at 3 months, which means we'll only repair the lip. We can't touch the palate until this baby gets to 9 months. So that's one of the things also the viewers need to understand. So which means we'll end up doing two surgery. Then for those who are very severe, there are some who are very severe. So you find they have bilateral cleft lip, and you find also it's very extensive and touching the nose. Sometimes for those, it is done in stages because we have specialists here in St. Francis, that the plastic surgeons and the pediatric surgeons, that we are able now to repair slowly over time. But for the most ones that are very mild, moderate, the lip can be repaired once and that's all. It doesn't need to be repaired again. Yes.
And also earlier you mentioned that there will be a camp for the babies who have this condition. Maybe once again talk to our viewers about it. When will it be happening? Okay.
So as St. Francis Community Hospital, we are teaching a referral hospital, a level 5 hospital. And as such, in terms of capacity, we're able to offer these surgeries actually across throughout the year. So because we partner with an organization that is called Smile Train, and these Smile Train are actually the ones who are able to help in terms of the capacity where you've had me talk of free, plus other, of course, as facility also we are able to offer the support so that we can make sure they get these surgeries free of charge. So what I wanted to highlight by saying that is that we actually provide these surgeries across the year from January to December. But now for the camps, we tend to organize them every year, once or twice per year, or even thrice. So now coming the month of June this year, from 21st to 27th, we'll be doing camp targeting surgeries for these children who have cleft lip and palate. So across the country, if you know anyone, or your neighbor or your brother or sister, anyone who has a baby who has cleft lip and palate, you can actually be able to contact us at St. Francis Community Hospital, and then we can be able to start preparation to book you and to be able to do other simple assessments that we do just to make sure that the baby actually qualify for that particular surgery. Yes.
So for anyone who would like to maybe reach out to you because, they've had this camp, they are not sure how they can access you, how can they do it? So basically,
one way is that as in Francis, we have very strong social platforms that one can actually be able to book for these services. You can interact with us in our social media. That is one platform. The second platform is that you can actually be able to call us as St. Francis Community Hospital. I think from that poster that you're holding, maybe you will help me to be able to read that number that is given there so that they can be able to book. Yes.
Wow, thank you so much for that. And also the services that people will be receiving on that day.
So the services here range from different specialists. So the first thing, just like the way when you visit any hospital, we'll have nurses who will be able to ensure babies are triaged. And triaging means that we check very key parameters for them. Talk of their weight, talk of their height, and all those parameters. So that's one of things that happens. The second thing, they expect to have a sitting with a nutritionist to be able to explain all those assessments of growth and development for the child. And then after nutrition assessments and counseling, because I'll be also educating them so that they can be able to know how to be able to deal with those challenges of feeding these children, then they're able to be seen by a pediatrician. And then from there, they also expect to meet now with a surgeon so that now we can be able now to proceed on and operate the child. So in terms of stay, as hospital, we provide the area that children will stay, because remember, we get so many children during these camps. So we always organize accommodation for them in the facility, as we also plan on how we'll be able to carry out the surgeries. And once the surgeries have been done and they're successful, and then we're able now to discharge them to their home. Yes.
And also, I also forgot to ask, you talked about the surgeries that the babies go through. So after that, is there any post-care, like are there measures that as a parent and also as a doctor, you're supposed to follow up with the kid?
Now that's a very good question, because when you have undergone surgery, especially for nutrition, there are key things that we train them. So we have a guidance in terms of how we expect. And maybe for our viewers' sake, I'll split this in very simple ways. We use weeks to be able to determine how the baby is going to be feeding. So the first week after this surgery, as a nutrition year, I expect them to be mostly on liquids, on clear liquids, basically, for the first week after the surgery. Now, moving on to the second week, I expect them to be now on a bit blended foods. They can be able to do blended foods or liquids, which means every food that we have in the house, as long as you convert it into a thick liquid, they can comfortably be able to take it in the second week post-surgery. Then now the third week, they can actually return back to the normal foods that they were consuming before. This is meant to safeguard and ensure that this surgery site doesn't open up. You can, so like if it's a cleft palate that has undergone surgery, if you start feeding solid foods immediately, some of them might get inside that wound or even make it to be able to open up all the lips, or even the lips based on the type of food. If you give food that the baby required to chew, and it's just the first 1 day, 2 days after surgery, it might open up. And if it opens up, then we have to go back again in surgery. And so to minimize those complications of opening the areas that have been operated, that's why I recommend to use that 3-week approach, so that we can make sure that there is 100% healing and we do not end up having opening of that section that has been operated. That's one of the aspects. But the other aspect is basically that, of course, we also book clinics. So we have clinics that we book to follow up and be able to see how they are progressing until they heal. Then now we can be able to discharge them completely. Yes.
How long would you say it takes for a full recovery?
So it, of course, mostly it depends. But by the time you get to a month, you find that most of these babies have healed. So I'll give it at least a 4 weeks to 6 weeks duration for one to completely heal. Yes.
So much for that. And our dear viewer, just like Dr. has said, they will be having a medical camp from the 21st June to 27th of June. And also, if you'd like to book with them and be part of the people who will benefit from this, you can always reach to them via their contacts 0793 468 184 or also 01124 66501. So make sure you contact them through these contacts, and you will be part of the people in the community who benefit from this camp. So, Dr. maybe your final message to the parents that are watching, and maybe they have a child that is having this, condition. Any message you have for them for a word of encouragement, and also you can once again emphasize to them that here at St. Francis Community Hospital, they can get the help they need.
Thank you. So what I want our viewers to know is that, one, as a mother, it is not your fault. Any mother can deliver such a child. And for fathers, because also you are supposed to offer support. When the mother delivers this child, it doesn't mean this problem comes from the mother side. So let's offer her support, because one, you need to know every mother expects to have a very normal child. So by not delivering a baby who is normal, she's already getting stressed up and she's getting worried. And I've had mothers even developing anxiety issues because of such a problem. So what I want you to be able to understand, it is not that mother's fault. But as I say that, also I can be able to emphasize that there is great emphasis in preconception nutrition. Preconception nutrition means that as a lady, let's always plan for these pregnancies. And if you can't plan, at least make sure you appoint of seeing a nutritionist so that you can be educated on what type of nutrients are very key for making your baby to be very healthy. Because remember, there's no miracle inside there when your baby is developing in the womb. They are using proteins, they are using vitamins, they are using minerals, they are using all these things to be able to develop. Now, that is the first approach. The second approach we've said is not mother's fault. The other approach that we can be able to say is that I've said this is something that can be corrected through surgery. So we do repair for those problems, and the baby can get back to have a very normal life. So if you have such a child, just don't worry. Book the consultation with us as St. Francis Community Hospital, and we guarantee that this is something that can be repaired. Then the other thing is in terms of the nutrition, the way I've said, this baby should be able to be fed just like any other child. And so please, if you are struggling outside there, just use that simple information that I've given, that if it's a baby who is below 6 months, they should be breastfed exclusively. If it's a very severe cleft and lip palate, you can visit us so that we can train you how to express that milk, how to be able to use some type of special cups that we use to feed these children, and then the baby can be fed well. Again, for those who are above 6 months, they should be able to be fed like any other baby, as long as we use those 3 type of diets that I've been able to give based on the age or the development. Last but not the least is that as St. Francis priest, I encourage all our viewers, if you know someone or yourself, you have a child who has cleft and lip palate, make an appointment of booking with us this coming June so that we can be able to repair that problem for your baby. It is absolutely free. You just come in, we do the surgery, and you go home free of charge. Yes.
Thank you so much, Daktari, and thank you so much for encouraging the mothers out there that it is not your fault. Every child is born a certain way, and it cannot be your fault. But once you find out your child has a certain condition, make sure you visit the hospital. Make sure you visit St. Francis Community Hospital for you to get the help that you need. Once again, just to remind you, they will be having a free surgical camp for the cleft and palate lip on the 21st June to the 27th of June. Remember, you can always reach them through 0793 468 184 or rather 011 246 6501. Well, that is all we had for you here today on the Health Show. Once again, I am Susan Bulemi, sitting in for Maureen Kimani. Until next time, stay safe, be blessed, and always keep it Capuchin TV.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Every child is unique, and so is their journey to health and well-being. At St. Francis Community Hospital, Kasarani, our pediatric department is dedicated to guiding that journey with expert care, compassion, and commitment to excellence. From the very first breath, our specialized neonatal services ensures your baby receives the best possible start. Our state-of-the-art neonatal intensive care unit is equipped to handle even the most delicate case, ensuring the smallest patients get the strongest support. As your child grows, regular health checkups are crucial. Our pediatricians provide comprehensive assessment, development screening, and immunization, supporting health growth every step of the way. Health is more than just prevention. Our team of specialist pediatricians provide a range of acute and chronic conditions, from asthma and diabetes to rare genetic disorders, with advanced diagnostic and personalized treatment plans. We also offer comprehensive rehabilitation services, including physical, occupational and speech therapy to help children reach their full potential, overcoming challenges with strength and resilience. Our hospital is open 24 hours a week. Visit us today for specialist pediatric care.
Hello and welcome to St. Francis Research and Training College, Kasarani. A serene, holistic and quiet environment where we educate hearts, inspire innovation and research anchored on faith and technology. We offer a variety of courses, both technical and health-related courses. For the technical courses, we have food and beverage, fashion and design, and ICT-related courses. For the health-related courses, we have caregiving, perioperative theater technician, and healthcare support service. We also offer foreign languages such as German, Guten Morgen, French, Bonjour. For more information, call this number and reach out to us. Welcome to St. Francis Research and Training College.
The Kenyan people have been struggling to access care, and this now as a church, we thought of looking for a way of complementing the effort being made by the government to supplement that effort by having CARIMED so that people can access care and the health institution can become sustainable.
With CARIMED now everybody should be able to afford healthcare because it has options for everyone. From the one who has not been employed to the ones who are employed, the ones who do not have a high income, those who have like low income, middle income, upper income, everyone has a product that suits them.
You realize that when you talk about other insurances, there is that capping of years. But there is a provision with CARIMED, there is a provision of even when you are 90, 100 years, that provision is there. And some of us, when we are here in Nairobi, we would like to take care of the insurances of our parents. And some are very old, some are 90, some are 80. So we have a way out. And CARIMED is answering now our many years prayer. So it's a dream come true, it's a prayer answer.